Hello, my name is Elizabeth and I'm a registered nurse in California. I have been a registered nurse for 13 years, and 12 of those years I worked in a hospital. And what I am seeing is the criminal herd immunity policy that was started under Trump and continued under Biden. They have lifted most mitigation measures and allowed children to go back into unsafe schools and become infected and die or suffer from long COVID symptoms. So I am for eliminating and eradicating this virus.
Hi, my name is Lamont Newton. I work at Forcia Automotive in Saline, Michigan. The conditions in the plant are unsafe, unsanitary. Their idea of COVID-19 and protecting the public is having the workers wear double masks and still working the same speeds, no extra breaks. It's like a factory, but a sweatshop. The union is nothing more than a corporate extension. Does not stand up for the workers in any way, shape, or form. It does collect dues, though. I will give them that.
I'm from Saline, Michigan, in the auto industry. And my job, it's unsafe. It's stressful. They're treating us like animals. They're not making sure that we are protected, and they're just concerned about their production and their money. People are dying at our factory from COVID. A lot of people touch the same parts in a lot of areas, and they're not sanitizing any areas after though we find out, or they find out that those people are being infected. We don't find out till weeks later after they return. I could be affected. I could die. My family could be affected. I could be a carrier. I could carry them back home. We are not getting any kind of assistance from the union. I want change. I want a better life for my family, and I want to unite workers, and I want to see other workers get help and get assistance.
My name is Anthony Fife, and I am an adjunct instructor at a college in the greater Dayton, Ohio area. The powers that be in my school have declared that they will follow all state safety guidelines in regard to COVID-19. Unfortunately, the state has clearly proven that it does not have our best interest at heart. I've had COVID-19 in my classrooms. I've seen COVID-19 in the homes of friends and my extended family. And I've seen the rates statewide remain alarmingly high. That is how I know that masks, social distancing, and even vaccinations are absolutely no substitute for a national and global policy of elimination.
Hi, my name is James Vega, and I am an educator here in Michigan. The school conditions in Michigan are horrible. 2 weeks ago, there were over 375 children under the age of 12 years old who were infected each day with COVID-19. It's not safe to go back into the building, even if we have mitigation measures. Locally, cases have risen so much that they've had to close local schools. One example of this is Bates Academy. The city is ran by the Democratic Party. Even with the mitigation measures, cases have gone up and the death toll has risen.
Hey, I'm Corinne. As a hospitality worker, I felt like my hands were tied behind my back when I was forced to go back to work during a pandemic. The working conditions in the bar and restaurant industry are not safe. When they reopened the economy, when people were still getting sick left and right, I think it's time we hold politicians accountable for the recklessness in their policies throughout this pandemic. And I think it's time we start listening to the scientists who know what they're talking about.
Hello everybody, I'm Raphaël Lapôtre. I'm a librarian living in France, and I'm the mother of 2 children. I feel very concerned with the effects of COVID-19 on the health of people who for any reason can't have access to a vaccine today, children under 12 being among these. It turns out that COVID-19 is not just a one-time infection like the flu, but can have continuous bad outcomes on vital organs such as the brain, the liver, the heart, and many others. The way this virus is damaging the body makes it closer to polio than the flu. By leaving vulnerable populations such as children exposed to this without any protection, we are willingly jeopardizing the future of an entire generation, leaving them with a reduced life expectancy and chronic illness. I live in a country where I know some of our ancestors have fought a war with the goal of leaving future generations with a decent life, a free and healthy one. I feel I have the same duty toward the next generation.
It is unacceptable to me that my granddaughter and her generation must live with COVID-driven madness. We're told our sole public option is to live or die with COVID. The sure consequences of reopening repeat everywhere, and yet it continues. Live with COVID because you must live with COVID. History will remember this betrayal of humanity.